Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is Dr. Todd LePine, a functional medicine physician and world-renowned expert on the human microbiome and its effect on health and disease. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
I am so pleased to welcome Dr. Todd LePine today to the podcast. He is board certified in internal medicine and functional medicine. His practice utilizes a multidimensional medical approach in health conditions. Welcome to the podcast today.
Thank you.
So you're speaking at the 29th Annual A4M World Congress, and your topic is about the multidimensional perspective on preventing and treating Alzheimer's. That's very interesting. Would you mind providing an overview of that topic for us?
Right. So Alzheimer's is the silent epidemic because years before you develop Alzheimer's, you have mild cognitive impairment where maybe you're not remembering things as well. A lot of people, might write it off to age. I mean, so you can have a little bit of aging, degeneration in terms of memory and such. But mild cognitive impairment is something that you get years before you develop Alzheimer's. And Alzheimer's, mainstream medicine has been working on Alzheimer's for years. They've been looking for the magic drug to treat Alzheimer's. And I'll tell you this right now, and I'll bet $10,000 in Vegas that there will never ever be one drug to treat Alzheimer's because it's a multidimensional condition. There's a component of genetics, there's a component of the immune system, there's a component of people's diet, there's a component of potential heavy metals, there's a component of stealth infections. I actually focus a lot about that because beta amyloid, which is what we find in the patients who have Alzheimer's, is actually an antimicrobial peptide. And oral bacteria, viruses, gut bacteria, when they get out of their locale, which is in the mouth and the gut, they can actually spread throughout the body and in the blood and can trigger a low-grade chronic inflammatory response condition, which ends up being the buildup of amyloid. And amyloid is the footprints for telling us that the body has been trying to fight an infection. And it's not like you have a fever, it's something that happens very slowly. So my approach at Alzheimer's is catch it early, do some deep dive testing to see what might be triggering it, and then do early interventions to help prevent it from progressing.
Okay, so what would one look for if they're thinking about being tested? Like what are some symptoms that they might have?
Well, the symptoms, would be, having some mild cognitive impairment where, they're not able to do math. They can't. Okay. Sometimes they'll drive and they get lost. Mm-hmm. They may have just some sort of like, they might write it off as, oh, this is just age related. I'm just, I'm now 70 years old and I'm not as sharp. Well, that's still not, because you can be 100 and still be very, very sharp and with it. Mm-hmm. And the treatment for any neurodegenerative conditions, especially patients who have Parkinson's and Alzheimer's, is don't wait for the horse to get out of the barn. You want to treat it very early because you'll have a much more success at reversing it and there are some patients that you can reverse it. You can do a backtrack in terms of getting them back to cognition. If they present later, then sometimes the only thing you can do is stop it or halt it from getting worse.
Okay, that makes sense. Thanks for sharing that.
Yep.
So what do you recommend and tell people to do to prevent maybe possibly getting Alzheimer's? What healthy habits and parts of their lifestyle?
Well, I just finished a talk in which I talked about a diet called the MIND diet. For those who aren't familiar about the MIND diet is a combination of the Mediterranean diet, which has been shown to be very helpful for heart disease and diabetes and obesity, combined with the DASH diet, which is a sort of a cardiovascular, low salt for blood pressure. And the MIND diet, they did this incredible study where they had patients take the MIND diet, and they did it for years, and then they did autopsies of the people that died. And they looked at the people who had Alzheimer's, and those who were on the diet and those who were not on the diet. And what they found is that the people who were on the MIND diet, they still had plaques in their brain, but their cognition was much, much better. So even though they had the markings of Alzheimer's, their function was really good. So I don't care if they have plaques in your brain. If you can think, walk, and talk and remember your grandkid's name, you're fine. So the goal of finding a drug, and there was actually just a recent FDA-approved drug that got rid of plaque. Getting rid of plaque does not actually treat Alzheimer's. That's not really the cause of Alzheimer's. It's more of a symptom of it. Just like when you find plaque in the arteries and they say, oh, you have cholesterol, too much cholesterol. No, cholesterol doesn't cause heart disease. Heart disease is caused by inflammation. Beta amyloid does not necessarily cause Alzheimer's. It's a marker of immune activation from stealth pathogens, including viruses like herpes simplex virus, bacteria in the mouth like Porphyromonas gingivalis, which dentists see, and then also gut bacteria. So those are some of the things that you can look at. Other things that can really help the average person is sauna therapy. There's a study out of a Finnish study that looked at Finns who did regular sauna, and those who did sauna 4 to 7 times a week, they decreased their Alzheimer's by 65%.
Wow. So what happens with the sauna that reduces it like that?
That's an interesting question. I'm not sure it's fully known. I'll give you some hypotheses about that. When you raise the body's temperature, it mimics a fever. And when you have a fever, your body produces these proteins called heat shock proteins. And these heat shock proteins help with modulating the immune system and also helping with misfolded proteins, which include things like beta amyloid. So it helps the body to clear out some of these protein aggregates and sort of clean the body up, and helps with the immune system. So that's probably one of the major ways in which it's helping prevent Alzheimer's. It's provoking the immune response, because when you think about it, like as you get older, you don't really get fevers as much, and fever is actually a good thing. Fever is your body's way of coping with a stealth infection. So if you get a cold or a flu, you're going to get a high temperature. As we get older, our immune system it's not as robust, it doesn't work as well. So sauna is a type of a artificial fever, if you will. And that's probably what's happening. It's probably doing that through heat shock proteins.
Okay, that makes sense.
Yeah.
What about someone who's had a concussion or multiple concussions? I've heard that can possibly lead to Alzheimer's.
Absolutely, that's a very good point. So traumatic brain injury, and one of the reasons that it leads to that is people who have the ApoE4 genotype, and everybody should know if they have the ApoE4. Do you know if you have the ApoE4?
No, I don't.
Okay, you should get tested.
Okay.
So ApoE4 is a gene which is associated with an increased risk for cardiovascular disease and Alzheimer's. A lot of people say, I don't want to get tested for that because I don't want to know. Well, it doesn't mean you're going to get heart disease or you're going to get Alzheimer's. It just means that you're genetically at risk. And those are the people that actually making lifestyle modifications, not being overweight, watching your sugar intake, not smoking, not drinking alcohol in excess, all of those things are things which can dramatically decrease the risk for Alzheimer's in ApoE4 patients.
Okay.
So those are things that you can do.
Well, those are some great tips. That's good to know.
Yep.
I guess we should all get tested.
Oh, absolutely. Yeah, it's a simple test to do, and that's really only one gene, but that's sort of what I call the low-hanging fruit in terms of looking at the genetic aspects of Alzheimer's. And there's also to differentiate. There's what's called early onset Alzheimer's, where you develop Alzheimer's like maybe in your 40s or 50s, and then there's late onset Alzheimer's, which is also called LOAD, L-O-A-D, for late onset Alzheimer's disease.
Can you possibly reverse early Alzheimer's?
That is not as well tested as the late onset Alzheimer's. There are probably hundreds of different genes that all play a role. And what you're probably best to do is to look at, in fact, there are companies out there that do genetic testing and look at all of the genes besides just the ApoE4 gene. So, your DNA is not your destiny. Just because you have a gene does not necessarily mean you're going to get a disease. Mm-hmm. It's like I always tell patients, genes and gene variations are like a loaded gun. And a loaded gun doesn't kill anyone until you pull the trigger. So pulling the trigger is your environmental input. Things that you're doing, things that you're not doing will activate your genes in a good way or an adverse way.
Okay. Thank you for sharing all your knowledge with us today. It's been a pleasure talking with you.
Thank you.